Welcome back. It's more common than you think. We're talking about fatty liver disease. There isn't a cure, and it can last several years or even a lifetime. But how do you get it? And how do you treat it? Joining me now to discuss it, experts in the field of clinical research for fatty liver disease. Welcome, Gwen Barger and Megan Angie. Thank you so much.
Thank you.
Now, you say it's on the rise and rarely talked about. I really had never heard of it. What should we know about it?
So fatty liver is this umbrella diagnosis that basically just means fat accumulation in the liver. So for many Americans, fat is accumulated in the liver due to excessive alcohol use. For those that don't consume alcohol, there's a different diagnosis that may be talked about, NAFLD, non-alcoholic fatty liver disease.
Wow. And what can you do when you're diagnosed with it?
So a lot of the time there are suggested
Measures to go into your PCP, your primary care physician, if you will.
Okay.
There's a panel called a metabolic panel that looks at your liver function tests.
Okay.
And due to the rise in obesity, those data results have been skewed a little bit higher due to the obesity epidemic. So people should really be conscientious of what their liver tests are when they're visiting their PCP and see if there's been any change over the last couple years to see if it's rising. With that, if they have any family history of hypertension or diabetes, in addition to having those elevated liver tests, it might behoove the patient to check to see if they can get an ultrasound, and they could potentially have a diagnosis of fatty liver.
What's a good level for your liver enzymes?
For women, it actually should be in the upper teens milligram per deciliter. Due to the obesity epidemic, now the average is usually around 30 to 40 milligrams per deciliter. But we're seeing that, thin, healthy adults that appear to be healthy on the outside have fatty liver disease due to just the trend in raising those results a little bit because a lot of people these days are eating more and consuming more.
Could it be fatal at all?
It can be. So under that non-alcoholic fatty liver disease, there's another diagnosis called non-alcoholic steatohepatitis. And that's a mouthful, but if you break it down into its parts, non-alcoholic, steato, meaning fat, hepatitis is inflammation specific to the liver. And if that inflammation goes unchecked, it can lead to advanced scarring and cirrhosis. And patients with cirrhosis have a higher prevalence of liver cancers. So it can very much be fatal.
Now, you mentioned hepatitis. Any connection to hepatitis A or C or?
No, so hepatitis strictly just means inflammation of the liver. So in cases of hepatitis B or C, that's due to a virus or infection.
Okay, and who would you say is most affected? I thought this is interesting. You'd think women or?
Pretty much everyone.
Wow.
Between 80 and 100 million Americans are diagnosed with fatty liver. They currently have it. And of those 80 to 100 million, 25% have that non-alcoholic steatohepatitis, the inflammation. And of that, 8 to 10% develop cirrhosis. So that may seem like a small number,
Yeah.
but in the grand scheme of things, you're looking at 1.5 to 2 million people in the United States who have undiagnosed cirrhosis.
And are there any symptoms?
No.
There aren't any symptoms. It's a silent disease.
Wow.
So that's why we were saying to follow up with your primary care physician, check those liver function tests, get an ultrasound, but then we have several research studies, if you do have a diagnosis of fatty liver, that are available to eligible patients that are, have oversight by the Federal Drug Administration and ethics committees. We have a great team of physicians at GI Specialists of Georgia, and we really encourage people to just follow up with their PCP, loop in with us, and just kind of everyone communicate and get on the same page, because this is a public health issue and it's a population health issue, and since there are no approved drugs, this could be a potential solution for many people.
And that's what I wanted to get into. No approved drugs to treat this at this point, so you really just have to change your lifestyle?
Yes, a lot about lifestyle, behavior modifications, but some of these new investigational drugs are showing positive results, showing that they can work. A lot of the studies are no cost to the patient either, so that's another plus. Their insurance isn't billed. They're also paid for their time and travel, and it's a voluntary decision. So at any point they can decide to withdraw their consent with no repercussions or cost to them.
I love that. Gwen, Megan, thank you so much. Now, if people have any questions about fatty liver disease or want to get tested, we've got a number for you on the screen, 678-741-5000.
Yes.
And any questions you may have about it can be answered there. Thank you so much. Very interesting.
Thank you.
Thanks.
And when we come back, a special fashion show for big brothers, big sisters of Metro Atlanta. Look at that, all courtesy of Saks Fifth Avenue. We'll be right back.